Welcome back to study section 2 on maternal and child health, NSC 511, which is family planning, education and counseling. At the end of this class, the learner should be able to state the general consideration before making a family planning choice, state the importance of rationale of family planning, give health education on family planning, counsel clients before providing family planning methods. Outlines: introduction, general consideration before making a family planning choice, rationale for family planning, health education or communication, and counseling. Just like it was mentioned in study section 1, reproductive life planning includes all the decisions an individual or couple make about whether and when to have children, how many children to have, and how are they being spaced. Health teaching is necessary because some couples want counseling about how to avoid conception, other needs information on increasing fertility and the ability to conceive. Others still need counseling too because of the failed contraceptives method. In this study section 2, we'll be introduced to general consideration before making a family planning choice, the importance and the rationale of family planning, health education on family planning, and counseling in family planning. General consideration before making a family planning choice. As I've said earlier on, that family planning is the ability of an individual or couple to decide whether to have children, how many children they desire to have in a family, and how to space their children. It's means of promoting the health of women and as well the families. Family planning is part of strategy. Part of strategy to reduce the high maternal, infant, and child mortality and mobility rates. A major benefit of contraception that has occurred is that there are both fewer adolescent pregnancies today and fewer elective terminations of pregnancy than formerly. As the study shown about the CDC in 2009. It is also a necessary thing to be able to answer questions about elective termination of pregnancy with up-to-date knowledge and objectivity for couples whose contraceptive method has failed and are considering another method. The legal and ethical issues, such as not allowing the enforced use of contraception for the physically or cognitively challenged, must be considered when counseling clients on the use of contraceptives. And with information and the ability to discuss specific concerns, clients can be better prepared to make decisions that are right for them. An ideal contraceptive should be 100% effective, compatible with religious and cultural beliefs and personal preferences of both the user and sexual partner. The religious and cultural beliefs of the family planning users should have a greater preference to them and to their partners too. Another ideal contraceptives should be free of side effects. It should be convenient to use and easily obtainable, accessible to get. It should be affordable and needing few instructions for effective use. And it should be free of effects after discontinuation and on future pregnancies. What are the rationale for family planning? The first one is allowing women and men the freedom to control the number, spacing, and the time at which they have children, which helps the women and their families to preserve their health and fertility, and also contributes to the improving the overall quality of their lives. Family planning also contributes to improving children's health and ensuring that they have access to adequate food, clothing, good housing, and good educational opportunities. It should also allow families, especially women, the time to adequately participate in developing artistic activities. What are the health education or communication that is related or regarding to this? Like other health services, a variety of methods, both formal and informal, are used in health education to offer family planning programs. Some are personal, that is, involving a health worker in direct contact with an individual or a group. Others are personal, in which the communication does not involve such contacts. For examples, the use of posters, the leaflets, the mass media, that is the newspaper, the radio, the television, and any talents. They are impersonal. They are not directly in contact with people. So each method has its own advantages and its limitations. The personal methods, which is the contact to contact, the direct one, have the advantages that the content can be specifically tailored to match the needs of the individual's presence. That will be comprehensive health education through communication. The healthcare provider will teach or explain comprehensively about the family planning to the people present. They will ask questions. The participants present will ask questions, and they will get the answers accordingly. It's also raised the opportunity for discussion where obscure points can be clarified. The objections raised and doubts expressed. Then through such interactive exchange, the health workers can learn more about local beliefs and habits of the people present. Then during talk with the family planning clients, which is the individuals or the communities, health workers must strive to be effective communicators. They must learn to explain technical information in simple language that is easily understood. The medical jargon should be avoided. Listening attentively. The skills of listening has to come in place. The healthcare provider needs to hear the opinions or the views of the participants, and this will promote the personal, and this will promote the personal stroke contact to contact health education. They must know the risk of capturing and retaining the attention of their audiences. This one is applicable to the healthcare provider. Then impersonal methods. Each health worker can reach relatively few people, especially the use of the mass media, which has the advantage of reaching large numbers of people who may not have direct contact with health workers. Then also messages can be repeated over and over again, serving as reminder and reinforcements. And in some communities, materials read in newspapers or heard on the radio carry more authority than information that is obtained from local sources. And without the opportunity for questions and discussions, however, such messages may be misunderstood. So constant repetition may dull their impacts, and individuals may have difficulty in relating the messages to their own circumstances. The third one is the combined approach, both the contacts, which is the personal and impersonal. It is sometimes possible to combine the advantages of both methods. For example, the word chats, radio and television programs, which are similar to impersonal methods, which could be used as the focus for small group discussions. Alternatively, gifted members of the community could be encouraged to produce word charts and other teaching materials for others in the community. They serve as their advocates. They serve as their mouthpiece, so that they will be the one to relay the message through the charts or through the word charts, through the teaching materials. And this will assist both the community and the individual as well. Innovative approaches to some teachings. Health workers have experimented with approaches to have health education, including music and drama, as means of projecting health messages like focus antenatal. They will sing songs, dramatize the songs, show people the messages, the related messages from the song. And this helps the antenatal women. This explained what the song means to them. And this promotes their heads as well. Film star promoting heroes, charismatic leaders, and politicians are used to launch and sustain most of the specific projects. Counseling. Counseling is a vital part of family planning, and it's a two-way process in which clients are helped to arrive at an informed choice of reproductive options, how to use them safely, effectively, and continuously. When family planning providers counsel clients, they progress through a series of interconnected and overlapping stages to help clients make decisions. And both the provider and the clients are actively participating. Throughout, the provider adapts the counseling process to each client's needs. And through this interaction, the client makes a decision, acts on it, and evaluates his or her action. Good counseling focuses on the individual client's needs and situation. Counselors are willing to listen and respond to the client's questions and concerns. And who are a good counselor? A good counselor understands and respects the client's rights, which earns the client's trust. A good counselor understands the benefits and limitations of all contraceptive methods. A good counselor understands the cultural and emotional factors that affect a woman's or a couple decision to use a particular contraceptive method. And in serving clients as a good counselor, it is important to remember that you have the right to decide they have the right to decide whether or not to practice family planning. They have freedom to choose which method to be used. They have right to privacy and confidentiality, and they still have rights to refuse any type of examination. Even though many contraceptive methods are highly effective, but some methods do fail. In the case of method failure, the client should be counseled about the available options and preferred appropriate services. Service providers should be aware of a number of factors about each client that may be important, depending on the method in question, which are the reproductive goals of the woman or couple, that is the spacing of timing births. They should be able to know the personal factors, including the time, the travel costs of each method, pain or discomfort that are likely to be experienced, accessibility and availability of other products that are necessary to use. That is the available and how accessible it is for other products or other methods which are necessary to be used. Counseling can be divided into 3 phases. The first phase is initial counseling at reception, method-specific counseling, follow-up counseling. The initial counseling at reception. This is where all methods are being described and the client is helped to choose the method most appropriate for her or for her husband. Method-specific counseling are the methods used prior to and immediately following immediately the service provision. The client is given instruction on how to use the method and common side effects which have been discussed. Follow-up counseling at the return, the visits of the clients, how the clients use the method, the satisfaction, and any problems which may likely to occur. What are the elements to the clients, to the counseling process? There are 6 possible elements of counseling process, which are easy to remember with the mnemonics or memory guide or memory aid, which is GADA. G stands for greet the clients warmly and politely. A stands for ask the clients about his or family planning needs. T stands for tell the clients about the family planning choices available. H stands for help client choose a method. E stands for explaining how to use the chosen method correctly. While R stands for return visits, which should be planned before clients leave the hospital. G, which is the greet the clients warmly and politely. Professor needs to introduce himself or herself to the clients and offer her a seat. They conduct the counseling section where no one can hear, which has to be related to the confidentiality. They tell clients what to expect during the counseling section, and the providers need to watch and sell the client's facial expressions, the gestures, the eye contact and posture. They should know from this whether they have interests or concerned about the different choices explained to them. A, which is ask the clients about his or her family planning needs. Provider asks the clients how she or the couple can be helped. If it's the client's first visit, the provider will need to take the medical history, both the past medical, surgical, social history, and likewise the present medical, past, social history also, in order to know how to come in, how to fit in, and how to help the clients. T, which is to tell the clients about the family planning choices available, which are through the program, through the referral to other to other health providers. With new clients, providers should mention all the methods available. Then the client can ask questions whether she or the couples knows about this method and offer to explain to them accordingly. H, which is help clients choose a method. Many clients may want to choose a family planning method. Some will know what they want, others may not be sure. Health providers can ask and answer questions. Help clients match their family plans, needs, and preferences with a particular method. E, which is explain how to use the chosen method correctly. Providers should give instruction clearly, noting any possible side effects and warning signs. They should ask clients to repeat information to make sure they understand what he or she has been sold. R, which is return visits. This should be planned before clients leave the hospital. With copper IUCDs, clients need to know when they must be replaced. During the comprehensive counseling, the pros and cons of these intrauterine contraceptive devices should have been explained to the clients, the complications, the benefits, what they should expect. The thread to be checked needs to be checked always and ensure it is properly there. What they should do if there is any crisis, if any crisis or complication arises, is for them to come back to the hospital, to come to the healthcare provider and explain to them. In conclusion, family planning is the ability of an individual or couple to decide when to have children, how many children is desired to have in a family, how to space their children. And as Ellen said about the counseling, which is vital part of family planning, which are in a two-way process, in which the clients are helped to arrive at an informed choice of reproductive options. There are possible elements of counseling processes, which are the greets. That is, greeting the clients warmly and politely. Ask the clients about his or her family planning methods. Tell the clients about the family planning method available. Help clients choose a method. Explain how to use the chosen method correctly. Return visits to the hospital. Thanks for listening.